Today, I am announcing the normalization of diplomatic relationships with Vietnam.
On July 11, 1995, diplomatic relations were formally normalized between the United States and Vietnam, followed by the opening of the U.S. Embassy in Hanoi in August 1995. In 1997, the first joint statement of cooperation was signed between the U.S. Department of Health and Human Services and the Vietnamese Ministry of Health. The first U.S. health attaché was posted, and the CDC office was first opened in Vietnam in 1998. At the turn of the millennium, U.S. and Vietnam reached a landmark bilateral trade agreement.
Just a few moments ago, Ambassador Barshevsky and Minister Vu Quan signed an agreement between the United States and Vietnam that will dramatically open Vietnam's economy, further integrate it into the international community, and increase trade between our two nations. And so from the bitter past, we plant the seeds of a better future. This is another historic step in the process of normalization, reconciliation, and healing between our two nations.
This included an agreement to provide further scientific and technological support for the developing Vietnamese healthcare sector. In 2001, the United States Agency for International Development, or USAID, established an office in Vietnam. 2005 was a very significant year in U.S.-Vietnam health cooperation. The U.S. President's Emergency Plan for AIDS Relief Program, or PEPFAR, the largest contributor to Vietnam's HIV/AIDS response, was launched with great success. Through PEPFAR support, the first HIV patients in Vietnam received free ARV treatment. Under the umbrella of the PEPFAR program, the Substance Abuse and Mental Health Services Administration, or SAMHSA office, was opened in the same year to provide expertise in drug addiction treatment. The U.S. government also became the largest supporter of programs implemented to better prevent and control influenza. In 2006, a 5-year agreement on health and medical sciences cooperation was signed between the U.S. and Vietnam. On November 11, 2006, U.S. President George W. Bush visited the Pasteur Institute in Ho Chi Minh City, underscoring Vietnam-U.S. cooperation in health and humanitarian efforts. 2 years later, the U.S. Department of Health and Human Services and the Vietnamese Ministry of Health agreed on a Memorandum of Understanding concerning food, animal feed, and medical products. In May 2008, the U.S. Department of Defense opened an office in Hanoi to provide further military support for the PEPFAR program. June 2008 was the first time a U.S. Navy hospital ship visited Vietnam and provided medical assistance. A key milestone of the PEPFAR program in 2008 was the opening of the first 6 methadone clinics for treating patients for heroin addiction as an HIV prevention strategy. In 2010, a partnership framework was established between the U.S. and Vietnamese governments to prevent and control HIV/AIDS. In this year, the Lower Mekong Initiative was also implemented, and USAID Vietnam reached full mission status. A special highlight of 2010 was the support of influenza vaccine development through the U.S. Department of Health and Human Services Biomedical Advanced Research and Development Authority, or BARDA. As a result, the Nha Trang Institute of Vaccines and Medical Biologicals, or IVAC, was able to successfully manufacture H5N1 vaccines, making Vietnam one of the few developing countries to produce its own avian influenza vaccines. 2011 marked the official cooperation between the two countries on military medicine. Over the next 2 years, the Mass Drug Administration Program, or MDA, provided deworming treatment for over 900,000 school children in 10 provinces. In 2013, U.S. and Vietnam established the Comprehensive Partnership. Later that year, the U.S. Secretary of Health and Human Services, Kathleen Sebelius, and Vietnamese Health Minister Nguyen signed a new 5-year agreement on health and medical sciences cooperation. Also, Vietnam was selected as one of 2 pilot countries to implement a 6-month global health security demonstration project.
Dear Mr. President and distinguished guests, thank you for inviting Vietnam to participate in the global health security agenda.
In 2014, the Global Health Security Agenda, or GHSA, was launched to accelerate progress toward a world safe and secure from infectious disease threats. With 28 other countries, U.S. and Vietnam committed to meeting the goals of the GHSA to better prevent, detect, and respond to infectious disease outbreaks. Vietnam also chose to be a leader in the Zoonotic Diseases Action Package and a contributing country for the Emergency Management Action Package. This year, 2015, the U.S. and Vietnam celebrate a historic milestone, the 20th anniversary of U.S.-Vietnam normalized relations. The U.S.-Vietnam cooperation has gone to new lengths to ensure that the goals of GHSA are met by inaugurating Vietnam's Ministry of Health EOC in Hanoi. In June 2015, the U.S. supported the signing of an aid memoir to support implementation of the National Action Plan on Antimicrobial Resistance. In July 2015, the General Secretary of the Communist Party of Vietnam, Nguyen and U.S. President Barack Obama issued a joint mission statement that includes cooperation on GHSA. At the same time, USAID and the Ministry of Agriculture and Rural Development signed an MOU to launch USAID's Emerging Pandemic Threats 2 program, or EPT2. In August 2015, with U.S. government support, Vietnam co-hosted with Indonesia an international conference to discuss implementation of multi-sector coordination to prevent and control zoonotic diseases. As part of the 2015 Pacific Partnership, U.S. and Vietnam conducted a successful drill on disaster relief and coastal medicine. In the past 20 years, the governments of the U.S. and Vietnam have improved the health and well-being of countless lives, families, and communities in Vietnam. Looking forward to the next 20 years, the U.S. and Vietnam partnership in health will continue to deepen, flourish, and contribute to global health security.